Chapter 23, Eating and Sleeping Disorders. Every individual has a body image. This is their perception, thoughts, feelings, and behaviors that relate to their body size and appearance. A positive body image will lead to behaviors that express confidence and self-assurance. Negative body images can lead to problems like shyness or social isolation. There are three features of an eating disorder. One is food-associated issues must be ongoing and not just an overindulgence at a party or skipping a few meals. Two, it must be or result in an impaired physical function that is due to either the inadequate or inappropriate use of food. And three, the problem behaviors result in an adverse psychological and social consequences. There are various theories for eating disorders. There is a behavioral theory that believes eating disorders are attempts to reduce anxiety or discomfort that an individual finds with their body image. There's cognitive, where the eating disorders result of deficits in attention, concentration, due to some underlying unresolved anxiety or depression. There's developmental, where the individual will fail to develop an appropriate sense of themselves. There's problems with autonomy and self-identity. These types of issues are often brought because of a significant loss or a crisis. There are social cultural theories where the eating disorders are thought to be a response to daily social emphasis on the stereotypical idea of thinness in the United States. Social stereotypes, they are stressors that actually drive women and girls to do harmful dieting behaviors. Anorexia nervosa is a way of mastering some control over these social stereotypes and the idea of maintaining thinness so the woman can feel successful throughout her life. There are physical theories where the cause of the eating disorder involves complex relationships with the body's neurotransmitter. This can often lead to an altered serotonin functioning. There are specifics for an individual that is diagnosed with anorexia nervosa. They will rarely use vomiting, diuretics, or laxatives. They have a great amount of weight loss. They are routinely younger individuals, more introverted. They deny any hunger. Their eating behavior can be considered normal for them, and it's a source of their own self-esteem. They are often sexually inactive. They may be obsessive or compulsive in nature. Their death will result eventually, if untreated, from starvation or suicide. They have amenorrhea, and they have few behavioral abnormalities. For anorexia nervosa, it is the refusal to gain weight. This is part of a strategy to solve a deep psychological problem and maintain a form of self-control. The average age of onset for anorexia nervosa is around 17 years old, but it can be seen in younger children. Early signs and symptoms will occur in children that have depressive symptoms and often obsessive behaviors. Children from dysfunctional or abusive families are at a greater risk for developing anorexia nervosa. And this condition or disorder primarily occurs in our industrialized society in America. Individuals that have anorexia nervosa will often go to great lengths to monitor their bodies 3 to 4 times a day. They may weigh themselves, measure body parts, look in the mirror to check for areas of fat. When severely anorexic individuals begin to resume eatings after periods of starvation, these individuals risk developing what's called refeeding syndrome. There are multiple complications that can occur from this syndrome, like heart failure and death from individuals who have had too little or no nutritional intake for great periods of time. For bulimia, there are specific criteria for its diagnosis. The individual will vomit or use diuretics routinely or abuse laxatives. They will have some weight loss. They can be older than anorexic nervosa individuals. These individuals with bulimia are often more extroverted and social. They do experience hunger. Their eating behavior is considered as a source of distress. These individuals are sexually active. They may have hysterical or borderline behaviors, often may be obsessive. Their death is from hypokalemia or suicide. They have absent or irregular menses. These individuals have abnormal behaviors that can be seen in stealing, drug and alcohol use, self-mutilation. For this individual, perfectionism is important, and it is what contributes to these overall binge purge behaviors. Bulimic women often have unrealistic expectations about their own self and how their lives should be occurring. Obesity is classified as an excess of body weight. These individuals are classified either as mildly, which is 20 to 40% above normal weight, or they can be moderately, which is 41 to 100% above their normal weight. They will often eat to control the emotional pain that they are feeling. This leads to compulsive overeating. Unfortunately, the first signs of obesity are seen early in an individual's life. Rumination disorder is uncommon. If it is seen, it is in childhood. It is actually considered regurgitation and rechewing of food. Partially digested food is brought back up into the mouth and then either spit out or chewed and reswallowed. There are no signs associated with this, so there's no signs of nausea, retching, or gastrointestinal disorders. The main therapeutic goal for all eating disorders is to just establish behaviors that promote the individual's health. This might sound very simple, but actually it's a very hefty goal, because people with eating disorders, they've learned to cope with their own stresses, and they use food as the focus in one way or another. The treatment for eating disorders requires medical and mental interventions. There are 3 short-term treatment goals for any individual with an eating disorder. The highest priority is to stabilize any existing medical condition or problem. The second goal is to reestablish a normal nutrition and eating pattern. And the third goal is to help the individual resolve any psychological or emotional issues that are underlying the actual disorder and the eating behaviors. Sleep occurs in cycles of 24 hours, depending on every individual's body rhythm. There are 2 phases to sleep. There are non-rapid eye movement, or non-REM, and then there is sleep and rapid eye movement, which is REM. The non-REM sleep is divided into 4 specific stages. To begin with, the individual will develop a natural or gradual grogginess until they actually go off to sleep, and they enter stage 1 of non-REM sleep. As the individual moves through each stage of the non-REM, the quality of their sleep will become deeper, and during stage 4, they are extremely difficult to arouse. After they reach stage 4, the sleeping pattern will then reverse, and the individual will go through the stage backwards. So they will go into stage 3 and then into stage 2, but they do not go back into stage 1 unless they are awakened. If the individual is interrupted at night or while sleeping or awakened during their sleep cycle, they have to return to stage 1 of the sleep cycle and then start the whole process. If disturbances in sleep occur often enough, the individual will experience signs and symptoms of sleep deprivation. As individuals age, they usually do not get a full night of uninterrupted sleep. Sleep disorders or sleep problems are common in today's society because life is fast-paced and it's extremely demanding. There are tests that can be done to determine a sleep disorder. They will do one is called a polysomnogram. This will monitor the effects of the electrophysical responses during sleep. A polysomnogram will include like an EEG or an electroencephalogram that measures brainwave activity. It may include an electromyogram, which measures muscle movement, and an electrooculogram, which measures eye movements. Primary sleep disorders are related to some type of abnormal functioning of the sleep-wake cycle or an individual's circadian rhythm. Dyssomnias are abnormalities of physical mechanisms that regulate the sleep and wakefulness of an individual. Dyssomnias can include insomnia, hypersomnia, narcolepsy, and breathing-related and circadian rhythm sleep disorders. A REM sleep dysomnia would be a sleep behavior disorder and restless leg syndromes. There are also parasomnias. As you can see, looking at the need for sleep, newborns need the most sleep, and they require 14 to 17 hours. As an individual ages, their number of hours of sleep necessary will decrease until they get to the adult stage, and then an adult requires between 7 to 9 hours of sleep every evening, every night. The most common dysomnia is a disorder of either falling asleep or maintaining a sound sleep. It's often associated with increased physical and mental alertness at night and then sleepiness during the day. Hypersomnolence disorder is excessive sleepiness despite sleeping at night. This condition usually starts around 15 to 30 years of age, and it progresses slowly over a period of time, and it can then will become chronic and eventually stabilize. Hypersomnia is characterized by prolonged sleeping episodes or frequent daytime sleeping that can occur daily for at least a month. And then excessive sleepiness can be severe enough that it causes impairment of daily living activities and not caused by any physical or mental disorder. Narcolepsy is an uncommon sleep disorder where the individual has repeated attacks of sleep. The symptoms will routinely become apparent during adolescence, but looking at a careful nursing history, It can reveal a pattern of sleepiness dating back to preschool. Cataplexy is a sudden episode of muscle weakness and loss of muscle tone that can last from seconds to minutes. Inappropriate rapid eye movement. This can occur during the transition between deep sleep and wakefulness, during which dreamlike hallucinations or paralysis of the voluntary muscles may occur. Obstructive sleep apnea happens during sleep, and this involves a partial obstructed upper airway, and this causes periods of hypopnea and apnea that happen repeatedly and then awaken the individual. Their sleep patterns are often characterized by long snoring periods, followed by periods of no breathing or apnea that can last as long as 90 seconds or a minute and a half. The apneic event will end when the individual will actually gasp, moan, mumble, or can shake with loud air-gulping snores. Obesity and people that are obese are often at higher risk for obstructive sleep apnea due to the excessive pressure on the area of the neck as well as the chest. Circadian rhythm sleep-wake disorder. This is a persistent pattern of sleep disruption that results from an interrupted personal body rhythm and the environmental demands. This disorder is seen frequently in individuals who do shift work or travel frequently. Sleep-related hypoventilation includes periods of decreased respirations that will result in elevated carbon dioxide levels in the blood. Restless leg syndrome or nocturnal myoclonus. This is characterized by sensations of prickling, tingling, itching, or crawling that occur while the individual is falling asleep or during sleep. The sensations are relieved oftentimes by moving the legs or walking and then return when the legs are not in motion. This is also called an idiopathic periodic limb movement. Parasomnias are sleeping disorders that are characterized by a behavior or a physical event that occurs during sleep that is abnormal. Nightmare disorder is when there are repeated frightening dreams that lead to abrupt awakening. The individual is fully alert and significantly distressed from the experience they had while asleep. The awakenings can be accompanied by the fight or flight response that includes sweating, rapid respirations, and rapid pulse. The sleep tremor disorder will involve repeated nightmares and abrupt awakenings that will be accompanied by a panicky cry or scream, as well as intense fear. During the episode, the individual can't be comforted or awakened without difficulty. Usually, the individual does not awaken but goes back to sleep. There is no memory of the event when they awaken. The sleep terror usually occurs only once a night during stages 3 and 4 of non-REM sleep. Sleepwalking is characterized by episode of motor movement during sleep. Individuals that do sleepwalk will rise from their bed, begin to walk around. They often have a blank stare on their face. They are not responsive to communications or not responsive to efforts to awaken them. If they are awakened during or after an episode, they don't remember very much about the event, and they may have a brief period of confusion until they become oriented. Nocturnal sleep-related eating disorder or binge eating during sleep is when the person has impaired consciousness while preparing food and eating it. They have little to no remembrance of the actions the next morning. During the sleep episode, the individual will consume a bizarre selection of high-calorie foods or non-food items. This is a huge safety problem because the individual can cause a fire in the home if they're preparing food and they're sleeping. Additional sleep disorders may be traced to a cause of a medical condition, mental health condition, or substance abuse disorder. There can be presence of neurological, cardiovascular, or respiratory disorders, or even an infection that has an effect upon one's sleep and their sleep pattern. The main goal of the care is to assist the individual to have a restful night's sleep. Hypnotics may be administered to promote sleep. Research has demonstrated that morning bright light therapy improves sleeping patterns by reestablishing natural biological or circadian rhythms. There have been studies that have revealed the body has a naturally occurring sleep hormone called melatonin. The nurse needs to be aware of how important it would be for the individual to keep a record of their environment during sleep pattern and keeping it brightly lit during daylight hours. There are some strategies to help with sleeping that the nurse can provide. Suggest a regular bedtime and wake time every day, 7 days a week. Suggest exercise daily. Suggest scheduling a time to wind down and relax prior to going to bed. Tell them to try to avoid worrying about falling asleep. To help them guard against any nighttime interruptions, you may suggest earplugs or thick window shades to prevent any light. They should have a comfortable bed. They should have a cool room. Sometimes a warm bath or warm drink before bed will often help aid in sleep. Any excessive hunger or fullness may interfere with sleep patterns, so individuals should be taught to avoid heavy meals before bed. A light carbohydrate snack can often be helpful. They should avoid any caffeinated or carbonated beverage, too much fluid intake, any stimulating medications. They should not nap during the day because that decreases the need for sleep in the evening. The individual should only use the bed for sleeping purposes and sexual activity, not eating, reading, working, or watching television. Maintaining a reasonable weight is helpful because excessive weight may result in fatigue and sleep apnea. And they need to get out of bed and engage in other activities if they are not able to obtain sleep.